11:43 exactly, and we're back right here on Mid-Morning Talk. We're going to be talking with Dr. Naseeba Kathrada, and I have to mention this. She was the doctor that obviously was our go-to person during obviously the dark, gloomy days of COVID, and she was really all pro ivermectin. Let me just say it out loud here on air that my husband and I too made sure that we took our ivermectin the moment we felt a bit under the weather or as it was prescribed. And Alhamdulillah, we did very well under those really gloomy, dark days of COVID. We do know there is a fifth wave on the horizon. Does that then mean, Dr. Naseeba Kathrada, that we might be going back to the story of ivermectin all over again? Assalamu alaikum to you. Welcome to the program.
Walaikum salam wa rahmatullahi. Thank you so much for having me. And I want you to know that I think that this is such an important platform and to get the message out there that I left a patient in theatre. That's why I'm in my theatre scrubs.
Alhamdulillah. Alhamdulillah. May Allah subhanahu wa ta'ala reward you for your efforts to talk to us. And also, I know that your patients are very close to your heart. So, inshallah, we'll try not to keep you here too long. But just to go back to the comment on ivermectin, you still hold those thoughts very fiercely.
Of course. I mean, we've seen more and more benefits now that it's 2 years into the pandemic here in South Africa. We are getting studies done from all over the world. But as you know, we didn't have a study that we did, but it was our anecdotal evidence and doctors talking together on the benefits of ivermectin. So I'll tell you personally, for me, we stopped using ivermectin as prophylaxis. We were doing that and in all the waves. And alhamdulillah, I've never had COVID. My staff have never had it. My kids have never had it. But I was reserving the ivermectin for treatment of COVID-19. What we've also found now is that because the limited supply, because of you can only get legal ivermectin through SAHPRA's Section 21 application process, which you know is quite long and laborious. We keep the ivermectin specifically for patients who are sick. And we're using it a lot for post-jab detox because we're finding a lot of effects from people who've taken the jab, which is the COVID-19 injection. And we're using ivermectin for that as well because it's very good at mopping up the spike protein. So inshallah, those people who have ivermectin and still have stock of it, please keep it with you. With regards to the fifth wave, as you said, in my opinion, we've reached a point in this pandemic or with the virus where, like any normal virus, a virus will become more transmissible but less virulent because it is not in the virus's best interest to kill its host. And at this point, we know that humans are the host for the virus. And when it infects a human being, it needs the body to be able to replicate. And if it becomes more virulent and starts killing off people, there will be no host left for the virus. So it's not in its best interest to become more virulent or become more deadly. So even if there is a fifth wave, inshallah, we know now that it is similar to the flu virus, where it will be seasonal and people will get different strains. Certain people will be susceptible. But we make dua to the Almighty that the next wave that comes is typical of the virus. If it is actually a natural virus, then it should just be a mild wave where people now, alhamdulillah, we know how to treat the virus.
Alhamdulillah, and shukran so very much for indulging me with that question regarding ivermectin. But I really needed to clarify that because you and I have talked on this very show in the past about ivermectin. There was a lot of controversy around that. But now let's go to this new protein that we're hearing about. It's probably been around for a very long time, but for some reason it seems to have gained momentum and a lot of attention in the press. And of course, in the beauty industry, I should imagine, regarding aesthetics is concerned. It's called collagen. What on earth is this? What are the health benefits? And if one starts using this as some form of, as some form of a multivitamin, as you take your other multivitamins, is it beneficial to you? So what exactly, I guess the key question is, what is collagen?
So basically, collagen is the most abundant protein in your body. So that's what it is. You find collagen in your muscles, in your tendons. You find it in your eyes. There's collagen everywhere throughout your body. So it'll be basically when we think collagen, you think connective tissue. So it's a thing in the past where a person has a bone, say a knee problem or an ankle problem, and they'll say, oh, I have some collagen, and that's where it was, where it helps to build the connective tissue. So like in a tendon or in a muscle. It's also because it's in between your discs in your vertebra. It's found in between there as like a shock absorber. That's where you'll find it. It's also the main component of reticular fibers that's in your eyes, in your skin vessels, and also you find collagen in your kidneys, in your inner ear, and also in the lens of your eye. So collagen is found in many places around the body. And what happens again when it comes to, I'm going to call it the supplement industry, or an industry that people are vulnerable to. It's, for me, it's a very shady area, because it's like you said, it's suddenly been in vogue where people now everywhere want to take it. And I know I've got two teenage daughters, and the one is all about her hair and her skin, and she's been, I mean, the amount of research that she did on the collagen was a lot. And it's not something that I would necessarily prescribe for my patients, because we know that it's naturally found in foods. And the one important thing to note is that if you do your research on collagen, it is found in bones, in animal bones a lot. So if you're making a bony broth, you'll get a lot of collagen in there. But when you're making it commercially, it's probably the cheapest way to make it is from pork gelatin or from pork skin, pig skin, bones. That is why it is very important that you look to see if the collagen is halal. And many times, from when I started looking at it with my daughter, I found, to be honest, the best one that so she's like me, she researches before she'll buy anything, was from in a doi pack, like one of these, these little packets with a little slider. That's the best one that she found. It's not necessarily cheap, but you get these ones in a nice fancy bottle and masked organic, and those things are like amazingly expensive. Read the ingredients there, and most of those ones are not halal. There's quite a few stores that even keep it. I mean, when did you ever go into a clothing store and buy collagen? And I was shocked when I saw it. I mean, I love going to poetry, and you walk into poetry, there's a big thing there with collagen. And I was like, really? I know that they sell like teas, and they'll sell like tea, it goes with the cup and saucer and honey and olive oil, and then like a whole stand of collagen. And I asked the lady there, and I was asking her, and she says, I said, but which of these are halal? And she knew. And if you don't take cognizance of that, then you are trying to embark on something when, firstly, it's not necessary. It's not something that you have to have, but also because of the way it's made from, and it's probably just cheaper to do that. But to the people out there who are wanting to take the collagen, I will say, do your research, read about it, and you'll find some really good articles. And always, for example, if in Ramadan, right, I tell my patients that they're allowed to eat a samosa, because we have like a special Ramadan eating plan for them, right? And it says samosa here. And I say, before you understand the calories, Google it. And for certain things, like if you're saying flings chips, or you're saying a Kit Kat, you will get the exact calories. But for samosa, your homemade samosa, my homemade samosa, a bought samosa, a fried samosa. So you will Google, and you'll find 3 or 4 different, one will say 80 calories, one will say 200, and then you find an average. It's the same thing. Read a few articles on the collagen. And if you look at one that is done by a nutritionist, or one that is done by a medical doctor, not a journalist that has done research, somebody that's giving you the actual core facts, and then you make your mind up. Because when a journalist writes it, they've done their research, and that is their opinion on what they've done, the research they've done. So for me, the key thing is to make sure that it's halal, and secondly, that it's a good quality collagen. And ask yourself why you're taking it, and why can't you do homemade, do something homemade that's going to give you the same benefits. And very importantly, I'm sure many people don't know this, collagen is absorbed best with vitamin C. So if you're having like a meal, with or if you're having a fruit just after you're taking your collagen, or if you're making a broth, make sure that you have some. And vitamin C, everybody, when you say vitamin C, I know the first thing people say, oranges. Yes, oranges are high in vitamin C, but they're not the highest. You know what what's very high in vitamin C? Bell peppers. You know the green pepper that we eat? Green pepper is very high in vitamin C. Guavas are very high in vitamin C. Strawberries, papaya, and then oranges. So we know it because oranges are readily available, but guavas have higher vitamin C than oranges. In fact, a green chili also has very high vitamin C, but I don't think people are going to be chomping on
No,
that.
absolutely not. Okay, so look, we have established, Naseeba, that this does seem to be the next big thing as far as
Yes,
aesthetics is concerned, and we
yeah,
all want to look good. We all want to try and look healthy, and if we can, kind of cheat a bit as far as how old we are. Why? Why not? What sort of benefits are there as far as collagen is concerned regarding your skin? And I know you are suggesting that you get the collagen in your diet if you follow a good enough diet or a healthy enough or a balanced enough diet. But I'm also hearing things like about it's good for your bones, for your hair, etc., etc. What about
yeah.
older people? I'm thinking, obviously, younger people may not necessarily need the collagen, but postmenopausal women, would collagen assist them in any way? Because everything's beginning to break down in their bodies and they're aging rapidly.
Yes. Well, the thing is, as your estrogen drops and when you postmenopausal, your hormones change and you do get more wrinkles. And the one thing is that you produce less collagen as you get older. So if you want to take a collagen supplement, it will play a role in strengthening your skin. It improves the elasticity of your skin so you don't get the wrinkles. It also improves the hydration. But the most important thing for hydration is water. So you can't be taking your supplement and not having enough water. So we also have to remember the basics. Put on your sunscreen if you want good skin. Vitamin C itself is very good for skin. And then, it's pointless now having spent 30 years in the sun and suddenly decide now I'm postmenopausal, my skin's not looking great, let me have some collagen. You also have to do all the other things with it. But yes, collagen is very good for strengthening your skin, improving elasticity, and also, because you're not producing enough as you older, taking a supplement, a good supplement, will also help. But also do some research and find things that you can just fit into your diet. I mean, I don't see us having bony broth every day, so it's probably just easier to take a collagen powder or a capsule. So you can definitely do that. And I see that it's also very much in vogue with the bodybuilders. Julie, I'm not sure if you've also noticed that, where people going to gym also want to take collagen. Have you seen that?
No, I haven't. What I have seen, or what I have been told, is men with beer bellies or with visceral fat on the, obviously, that if they take the collagen, it's going to help break down that visceral fat. You are the doctor. Is that true or not?
Well, the only benefit that I can see from people going to gym taking the collagen is that people who are overweight will tend to injure themselves if they're doing the wrong exercise, especially because they've got weakened joints and they'll end up with a tendonitis or they'll end up hurting their knees, especially on the treadmill if they're doing it, especially if they're doing weights, and then you'll get elbow injuries and all of that. So if collagen, taking a collagen supplement will help strengthen that, it will feel as if they got more energy to exercise and probably give them a chance to exercise more. And that's why they probably see benefit because they're taking the collagen, but it's not a direct link. I don't know of a direct way that, that it will actually burn fat. Like I said, it's like for joint pains. And also, exercise in itself helps to prevent bone loss. I'm just trying to think of a mechanism, but I don't think so. It may, because it's high in muscles. It may promote muscle mass, but you can't just take the collagen and go to the gym and expect that to happen. You've got to do it with the correct eating and you've got to do the correct exercise. Then you will get the conversion, and then you look like they say cinched or ripped or six pack because you got nice definition of your muscles, but you're doing everything else. Besides the collagen, you're doing the hydration, you're doing the correct exercise, and you're eating properly. Because bottom line, Julie, 80% of weight loss comes from eating. Everything else that you do is in addition to. And that is one of the biggest, I would say, exploited fats on the market, right? Because like you said, it's the next big thing. People will hear fat burner, everybody will rush to take it. People will hear a banting, everybody will rush to do it. Either way, it doesn't matter what that other 20% is. You still got to do the 80%. And just to boost it, you can do things like the collagen. But inshallah, it will work if you got the good quality one and you're doing everything else. You will get your results.
So coming back to what you had said earlier on, do your research, and also ensure that the collagen that you are buying is definitely halal. Let's just go back to the issue around the postmenopausal women. The question then to ask is, let's make a comparison between collagen and a hormonal supplement. Which would you say, and I don't want to put your back against the wall on this one, but which would you say would be more beneficial to someone that's going through menopause?
Well, what I will say, and I will say this generally, does not only apply to postmenopausal women, is you have to have an individual assessment. There are certain people, like when I do a body type analysis, my O-type patients always have issues post-menopause, but those are hormonal issues. So in that particular kind of person who has issues with hormones, of course, in that individual, they can still take the collagen, but it's not going to make as much difference if they haven't done a hormonal balance first. And you don't have to do an allopathic hormonal balance. You can do a natural hormonal balance. There are so many good alternate, I don't want to call them alternate, I will say natural medicines. There's a TIB range that is wonderful. That's the one I use in my practice for my postmenopausal patients. So you will look at the balance. In another person who's probably an A-type, like a muscular woman who never had any problems with periods and sailed through menopause where she didn't have any hormone issues. In that particular person, now they want to start exercising because they're feeling a bit of midlife bulge. Then in that person, the benefit would be collagen first, and then, would consider hormone replacement. So you have to look at an individual, regardless of the age and regardless of the illness or what you're trying to treat. You can't just make a blanket rule and say, everybody must take collagen or everybody must do hormone replacement. So it will be very individualized.
My final question then, Dr. Naseeba Kathrada, is we've talked about collagen. We've talked about the possible benefits, health benefits. It's going to make you look better. It's going to help with wrinkles, osteoporosis, etc., etc. Are there any side effects that we need to be worried about?
Well, with anything that you take, with any supplement, one of my favorite sayings is from Linus Pauling. So Linus Pauling was the gentleman who discovered that vitamin C is for scurvy. And he said, multivitamins don't work. Those who need them can't afford them. And those who can afford them don't need them. When it comes to things like supplementation, when you're having too much of it, you just end up with expensive urine, so it's expensive pee. But with something like collagen, which is also a protein, you don't want to end up with too much of protein because you put your body into, you have a lot of trouble with your liver then if you've got too much of protein in your body. So you have to take a good quality one. You've got to take it with doing all your other things around it, and you have to make sure that you're taking the right quantity. It's like taking half a Panado. That's not going to work, but taking 5 is not the right thing either. It's safe, but in that one person who has an allergic reaction or it has a problem with their kidney or liver, it's going to be a problem. So again, it'll boil down to doing your research, and research on an individualized basis. So if you've done research for you, you can't just say to your friend, hey, I did the research, this is what you must take. No, you can say this, I did the research, here's the research. Do it for yourself. And then you tell me, I'm taking 3 tablets or 5, or you taking 2. Why? Because this is what happened. And then we each know that we each are important. Each of us is an individual. We've been made, Allah made us all different for a reason. So we can't just generalize. Be careful of the amount you're taking. Too little will do nothing. Too much is not necessarily good for you.
And I did say it was the last question, but the golden rule. The golden rule, this was obviously when we were in the thick of COVID-19, is a lot of us, my husband and I, are still continuing on this regime, is the vitamin C, the zinc, Oh
D,
gosh.
vitamin C, vitamin D, vitamins.
Oh, there you go. And we're still on it, we still continue with it. Often people kind of say, like you had said earlier on, is you're just producing very expensive urine. But because of COVID-19, are we still doing the right thing by taking those specific vitamins and minerals to keep us in good health?
Well, two things I want to say. The first thing is zinc is very good for hair and nails as well. And vitamin C is very good for skin. So if you want to take a collagen supplement, you must do your vitamin C and zinc because that's an adjunct and it's going to work together. So already in that context is very important. And regarding your answer, COVID has taught us many lessons. And one of the things it's taught us is that you have to learn how to balance your health. And for good health, you also need to boost your immune system. But you don't only have to take supplements. I've got a detox protocol that's out. It's been circulated widely. On the first page, I don't talk about supplements or anything. The first thing is sunshine. Hydrate, sit in the sun every day for 20 to 30 minutes if you are unwell. But if you are well, also make sure you're getting a lot of sunshine. Hydration, especially in Ramadan. It's the first thing at the bottom of my plan. It's to drink your water because people forget to hydrate. If you don't hydrate, everything else. Dehydration is the number one cause of lack of concentration, number one cause of headaches, number one cause of backaches, and it's the number one cause of hunger. So it's sitting in the sun, hydrate, de-stress. And one of the commonest things we need to do, or the easiest way to de-stress, is put your phone away during awake hours for at least 1 hour. I've tried that. It's not easy, but try 1 hour, not when you're sleeping. 1 hour during awake time, no devices. Stay away from the devices because of the Wi-Fi and energy and the frequency. That again is going to deplete it's going to drop your immune system. So after doing all of those things, you can do things like I've got a Himalayan salt lamp. I keep it on in my practice all the time. And then comes the part with the supplements. And again, I just saw that question come up and I got
Yes, absolutely. I was about to ask you. We'll have to answer it before we wrap up.
I'd like to answer it. Okay, so I have an opinion on not just on the boosters. I have an opinion on the vaccines anyway. Firstly, they're not vaccines. It's a gene therapy injection. I don't like that word either because I drive a GTI and gene therapy injection is GTI. So it's a gene therapy injection. Make no bones about it. Personally, I haven't taken the vaccine. None of my staff have taken it. My kids haven't taken it. And my reason for not taking it is that I don't know enough about it. And once you put it in your body, you can't take it out. And the word booster is just one of the words that they use to make you feel like you've been boosted. There's no limit to it. I spoke to a friend of mine in Vienna yesterday. They're up to 6 in Europe, 6. So how many are you going to take? For me, I haven't taken it. I won't even take one until I know that the benefits outweigh the risks for me. And again, on an individual basis, I'm not happy that I know enough. And what I'm seeing in my patients who are coming to be jabbed and boosted is a bit scary. So that's an entire topic for another day. We're seeing a lot of cancers, remission, people are getting cancers, illnesses, especially if they're boosted. So I hope that...
Okay. That's where we have to leave it. It's been fascinating talking with you today. Thank you indeed for interrupting your procedure and coming to talk with us. Inshallah, we'll talk again, and we truly value everything you've shared with us on the show this morning regarding collagen. Until the next time, as always, keep us in your du'as, and salaam alaikum to you.
Wa alaikum salam. Jazakallah for having me.
Okay, 7 after 12 o'clock. We have overrun there, but it was a very important conversation. We needed to uncover as much as we possibly could. Inshallah, in a minute or two, we are going to be talking with Islamic Relief South Africa. So do stay